We talk so much about staying active and, keeping up with our physical health as we get older. But sometimes I feel like proper nutrition gets kind of lost in the shuffle.
Oh, for sure.
You know what I mean? So I
Yeah.
think it's awesome that we're taking this deep dive today into Chapter 3 of Nutrients and Nutraceuticals for Active and Healthy Aging.
Yeah.
Such a practical resource for anyone who wants to understand the often subtle nutritional needs of, older people.
Definitely.
And by the end of this, you'll be full-on nutritional detectives,
Right.
able to spot potential issues and advocate for the seniors in your life.
I love that nutritional detective.
Yeah.
That's a great way to put it.
So the chapter really dives into this whole idea of increasing lifespan through proper assessment, which is fascinating.
It is.
So let's unpack this, starting with the impact of malnutrition,
Okay.
because it's not always as obvious as you might think.
Exactly. Yeah, we often associate malnutrition with being extremely thin, but it's a much broader issue.
Yeah.
It's about the body not receiving the nutrients it needs to function optimally.
Yeah.
And that can manifest in a lot of different ways.
The chapter paints a pretty vivid picture of this vicious cycle that can develop.
It does.
As people age, various factors can lead to a decline in appetite, or changes in their metabolism, or difficulty absorbing nutrients.
For sure.
And then this can lead to a loss of muscle mass,
Right.
which then affects their mobility and overall function.
Exactly.
And because they're less mobile, they may become even less active and eat even less.
Yeah.
And it just further exacerbates the problem.
It's a domino effect.
It's like the domino effect.
Yeah.
And it really highlights why early intervention is so crucial.
For sure.
Now, the chapter outlines a 5-step assessment process to help us identify and address these issues. And they are clinical assessment, blood parameters, nutritional assessment, anthropometric measurements, and body composition analysis.
Got it.
Now, I know that might sound like a lot at first.
Yeah.
But the chapter does a good job of breaking it down.
It does.
In a very manageable way.
Yeah, and keep in mind, all of those steps work together to create a comprehensive picture of an individual's nutritional status.
Right.
It's not about relying on any single marker or measurement, but it's really about, understanding the interplay of all these different factors.
They all work together.
Exactly.
Okay, so let's start with the first step.
All right.
Clinical assessment.
Okay.
What are some of the things that we should be paying attention to?
Well, think of it as, kind of like looking for clues.
Okay.
The chapter mentions seemingly surface level observations that can actually reveal a lot, like dry skin, poor wound healing, thin hair, or even spoon-shaped nails.
Wow.
All of those can be red flags
Yeah.
for underlying nutritional deficiencies.
Really?
Yeah, it's like our bodies are trying to send us subtle signals.
Wow. So it seems like these clinical signs often go hand in hand with the next step.
They do.
Analyzing blood parameters.
Right.
The blood work.
Exactly.
Okay. Most people are familiar with seeing their albumin levels
Yes.
on their blood tests. But the chapter points out that while albumin is commonly used,
Yes.
it does have its limitations.
It does, because albumin has a long half-life,
Okay.
which means it takes a while for levels to change, even if someone's nutritional status has recently declined.
Oh, so it's not like
Not an immediate marker.
not an immediate, right?
Got it.
So if we're looking for more, immediate insights,
Right.
we need to turn to other markers like prealbumin
Okay.
and
What's
transferrin.
that?
They have shorter half-lives, so they give us a more dynamic picture
Okay.
of what's happening nutritionally.
So it's like getting a real-time snapshot
Yeah,
versus looking at an old photograph.
that's a good way to put it.
Yeah.
Yeah.
Okay, that makes sense.
It does.
The chapter even provides the normal ranges for these markers.
It's helpful,
In table 4.1,
which is really handy to have.
it is a handy reference.
Okay, so we've gathered clues from the physical exam and blood work. Now comes the tricky part.
Okay.
Figuring out what the older adult is actually eating.
Right.
And this is where nutritional assessment comes in.
Uh-huh.
But as the chapter points out, this can be particularly challenging with this population
Oh, absolutely.
because of potential, cognitive decline,
Right.
memory issues,
Yeah.
or even just, the reluctance to meticulously track food intake.
Yeah. It can be difficult to get an accurate picture.
It can.
For sure.
And the chapter outlines the standard methods like the 24-hour recall,
Yeah.
where you basically ask someone to list everything they ate in the past day,
Yeah.
food records, where they keep a detailed log of their intake,
Uh-huh.
and food frequency questionnaires, which ask about how often they consume certain foods.
Okay.
But these aren't always ideal for older adults.
No, especially if they have those cognitive or memory issues.
Yeah.
Yeah, can be a challenge.
So the chapter highlights some really interesting alternative approaches.
It does.
Like it mentions MEDAS.
Okay.
Which is a specialized questionnaire that's adapted for older adults.
Got it.
And it focuses on food groups and portion sizes that are relevant to their dietary needs and habits.
Yeah, it's about using the right tool for the job.
It is.
Yeah.
Now, weight loss is another crucial piece of this puzzle. But the chapter makes it clear that there are different types of weight loss.
Right.
And we need to distinguish between them.
Yeah. Can you explain that a little bit further?
Sure. So we need to distinguish between wasting cachexia and sarcopenia.
Okay.
Each has distinct underlying mechanisms.
Yeah.
So wasting is a general loss of body weight.
Okay.
Often due to inadequate calorie intake or malabsorption, affecting both fat and muscle mass.
Got it.
Cachexia is a more complex syndrome characterized by a loss of lean body mass, particularly muscle.
Yeah.
And it's often associated with chronic diseases like cancer, heart failure, or kidney disease.
Right.
And then finally, sarcopenia,
Yes.
while also involving muscle loss, is primarily driven by the aging process itself.
Okay.
So it's not just about the number on the scale.
No, it's not.
It's about understanding what's driving that weight loss.
Exactly.
Which is really important for determining the right interventions.
For sure.
This leads us to the final step in the assessment process.
Okay.
Body composition analysis.
Got it.
And this is where we move beyond just weight and height.
Yeah.
And look at the proportion of fat and muscle mass in the body.
That makes sense.
And as the chapter points out, BMI, while useful, doesn't tell the whole story.
It doesn't.
Especially in older adults who might have a normal BMI, but high fat mass masking underlying sarcopenia.
Exactly.
So we need additional tools.
We do.
To get a more complete picture.
Yeah.
The chapter mentions circumference and skin fold measurements, which can provide some insights, but it really emphasizes BIA and BIA.
Okay, can you break those down for us?
Sure. So BIA stands for bioelectrical impedance analysis.
Okay.
And it involves sending a very low, safe electrical current through the body. And the speed at which that current travels tells us about the composition of the body.
Okay.
Because muscle and fat conduct electricity differently.
Interesting.
BIVA, or bioelectrical impedance vector analysis, takes this a step further.
Okay.
By looking at the distribution of water within the body.
All right.
Which can be an important indicator of hydration status and cellular health.
Gotcha.
Both BIA and BIV are non-invasive and provide valuable information about body water distribution, fat mass, and muscle mass.
So they're really helpful tools.
They are.
Okay.
Now, I've never heard of the phase angle before.
Oh, yeah.
Can you tell me about that? What is that and why is it important?
Yeah, so the phase angle is one of the measurements that's derived from BIA. And it's kind of like a window into your cell's health. Yeah, so a lower number can actually indicate problems with cell integrity and function.
Wow.
And it's even been linked to an increased risk of age-related health issues.
It's like a little sneak peek
Yeah.
into how healthy your cells are.
Exactly.
That's fascinating.
It is.
Okay, so we've covered a lot of ground here.
We have.
But I think the main takeaway is that a comprehensive approach is essential for accurate nutritional assessment.
I agree.
In older adults.
Absolutely. It's about, you know, understanding the nuances, recognizing the challenges, and utilizing a multifaceted approach to make sure that older adults are getting the nutritional support they need to thrive.
So it's about becoming a nutritional detective.
It is.
Piecing together all these clues to create a personalized plan.
Exactly. And that's what we'll explore further in the next part of our deep dive.
Awesome.
Where we'll delve into what we can actually do with all this information and how we can translate these assessments into practical strategies for supporting older adults.
Love it. But before we move on,
I
want to leave you with a thought-provoking question.
All right.
That stems directly from the chapter.
Okay.
The authors present a BIVA analysis in figure 4.2 that shows the body composition of two individuals with the same BMI, one middle-aged and one older. And what's striking is how different their BIVA readings are.
Interesting.
So here's the question for you to ponder.
All right.
Why might two individuals with the same BMI have drastically different BIVA readings? And what implications does this have for their health and well-being?
Good question.
We'll explore this question further in our next segment.
Sounds good.
But until then, keep that image in mind.
I will.
We'll be right back after a short break.
Okay. You know that question about the two individuals with the same BMI, but drastically different BVA readings, really highlights why we need to look beyond simple weight and height measurements.
Yeah.
Especially as we age.
Absolutely. Okay, so let's break down why those BVA readings might differ so much.
Okay.
Even with matching BMIs, what's going on beneath the surface?
Well, remember, BVA gives us a much more detailed look.
Right.
At body composition, it takes into account the distribution of water, fat, and muscle mass within the body, not just overall weight and height.
So two people could weigh the same and have the same height, but have very different proportions of these components.
Precisely. And as we age, it's common to see a decrease in muscle mass and an increase in fat mass, even if overall weight remains stable.
Okay.
And this is where the concept of sarcopenic obesity comes in.
Sarcopenic obesity. That sounds almost like a paradox.
It does, doesn't it? But it's a reality for many older adults.
Huh.
They might appear to have a healthy weight based on their BMI, but underneath they're losing muscle and gaining fat.
Wow.
And this shift in body composition can have significant implications for their metabolic health, their mobility, and even cognitive function.
So thinking back to that BIVA analysis, the middle-aged person likely had a higher proportion of muscle mass and lower fat mass compared to the older person, even though their BMIs were the same.
Exactly. And that difference helps explain the variation in their BIVA readings.
Okay.
The older individual might have a lower phase angle, which, as we discussed earlier, can indicate decreased cellular health and a potential risk for age-related health issues.
It really underscores why these more nuanced assessments are so important. We can't just rely on what we see on the surface.
Absolutely.
We'll have to dig deeper.
It's about looking beneath the surface and understanding those underlying changes that are happening within the body. And this knowledge empowers us to make more informed decisions about nutrition and lifestyle interventions.
Okay, so we've established that nutritional assessment is crucial. But the big question is, what can we actually do with this information? How do we translate these assessments into practical strategies for supporting older adults?
That's where the real work begins. And personalized interventions become key.
Okay.
So once we have a clear understanding of an individual's nutritional status, we can tailor recommendations to address their specific needs and goals.
So it's not a one-size-fits-all approach.
No.
It's about creating an individualized plan.
Precisely for someone with sarcopenic obesity, for instance.
Okay.
The focus might be on increasing protein intake to support muscle growth and incorporating strength training to help preserve muscle mass.
Okay.
We might also look at strategies for reducing inflammation, which is a key driver of cachexia.
That makes a lot of sense. What about for someone struggling with age-related anorexia?
That's a good question, and that's where understanding the underlying causes is paramount.
Okay.
So is it a sensory issue?
Okay.
A medication side effect, or perhaps a symptom of depression?
Wow.
Once we identify the root cause, we can explore targeted solutions. It might involve adjusting medications, providing nutritional supplements, or even addressing social isolation, which we know can play a significant role in appetite loss.
It sounds like there's a real detective element to this.
There is.
Figuring out the clues, and tailoring the approach accordingly.
Yeah, absolutely. It's about putting all the pieces of the puzzle together to create a comprehensive plan that addresses not just the physical, but also the psychological and social aspects of nutrition.
I love that this deep dive has really shed light on the complexity of nutritional assessment, but also the incredible potential it holds for improving the health and well-being of older adults.
Absolutely. Even small changes can make a big difference.
They can. So what are some other red flags our listeners should be aware of, those subtle signs that might warrant further investigation, aside from what we've already discussed, of course?
Well, sudden or unexplained weight loss is always a concern. Changes in appetite, difficulty chewing or swallowing, and even dental issues can impact nutritional intake.
It's interesting how something seemingly unrelated like dental health can actually play such a significant role.
Absolutely. If someone is having trouble chewing, they might avoid certain foods.
Or
eat less overall, leading to nutritional deficiencies.
So being attuned to those seemingly small details can actually make a huge difference.
It can.
What about cognitive changes?
Yeah.
Could those be linked to nutritional issues as well?
There's definitely a connection between nutrition and cognitive function.
Okay.
Certain deficiencies, like B vitamins or vitamin D, have been linked to cognitive decline.
Wow.
On the flip side, A Mediterranean-style diet, rich in fruits, vegetables, and healthy fats, has been shown to have protective effects on brain health.
So what we eat can literally affect how we think.
It can.
It's incredible.
It really highlights the power of food as medicine.
Yeah.
By making conscious choices about what we nourish our bodies with, we can have a profound impact on our overall health and well-being.
At any age.
At any age, exactly.
This is all incredibly empowering, but I can imagine it can also feel overwhelming for some listeners.
Sure.
Where can they go for reliable information and guidance if they want to learn more or advocate for an older adult in their life?
That's a great question. Registered dietitians are a fantastic resource.
Okay.
They have the expertise to provide personalized nutritional counseling, taking into account an individual's medical history, dietary needs, and lifestyle factors.
So they can help create that tailored plan we were talking about earlier.
Exactly. And there are also many reputable organizations like the National Institute on Aging and the Academy of Nutrition and Dietetics that offer evidence-based information and resources on healthy aging.
Awesome. We'll make sure to include links to those resources in the show notes for anyone who wants to explore further.
Yeah, and remember, even if you're not a healthcare professional, you can still be a powerful advocate for the older adults in your life. Just by being informed and engaged, you can make a world of difference.
Absolutely. Now, before we wrap up this part of our deep dive, I want to revisit the topic of body composition.
Okay.
And how it changes as we age. We've talked about the limitations of BMI and the importance of looking at factors like muscle mass and fat distribution. The chapter touches on several methods for assessing body composition, including circumference measurements, skin fold thickness, and bioelectrical impedance analysis, or BIA.
Right. And as we discussed earlier, BIA, particularly BIVA, can be a very useful tool.
It gives us that more comprehensive picture.
Right, it does.
And not only measures the amount of fat and muscle mass, but also the distribution of water within the body.
Exactly. And that water distribution can be an important indicator of hydration status and cellular health. Plus, it's non-invasive, which is a big plus for older adults.
Absolutely. It's a simple, painless way to get valuable insights into body composition.
It is.
Helping us tailor interventions to support healthy aging. Now, there's one aspect of the chapter I want to explore further before we move on. The authors delve into the different types of weight loss. Wasting cachexia and sarcopenia. Can you walk us through those differences and why it's so important to distinguish between them?
Of course, while all three involve a loss of body mass, they have distinct underlying mechanisms and implications. Wasting, as the term suggests, is a general loss of body weight, often due to inadequate calorie intake or malabsorption. It can affect both fat mass and muscle mass.
So it could be a result of factors like poverty, lack of access to food, or even digestive issues.
Exactly. Cachexia, on the other hand, is a more complex syndrome, characterized by a loss of lean body mass, particularly muscle, and is often associated with chronic diseases like cancer, heart failure, or kidney disease.
So it's not just about not eating enough.
It's not.
There's something else driving that muscle loss.
Right. Cachexia is driven by a combination of factors, including inflammation, hormonal imbalances, and metabolic alterations. It's often accompanied by a loss of appetite and a feeling of fullness, even after eating small amounts.
That sounds incredibly challenging to manage.
It can be, and it often requires a multidisciplinary approach involving medical management of the underlying disease, nutritional support, and even psychological counseling. Now, sarcopenia, while it also involves muscle loss, differs from cachexia in that it's primarily driven by the aging process itself.
So it's a natural consequence of getting older?
To some extent, yes. As we age, we naturally lose muscle mass and strength.
But
this process can be accelerated by factors like inactivity, poor nutrition, and hormonal changes.
And sarcopenia can have a significant impact on mobility, independence, and overall quality of life.
Absolutely. It increases the risk of falls, fractures, and functional decline, making it a major concern for older adults.
This distinction between the different types of weight loss is fascinating.
It is.
It really underscores the importance of a thorough assessment to determine the underlying cause and guide appropriate interventions.
Exactly. A one-size-fits-all approach simply won't work. We need to understand the individual's unique circumstances and tailor our strategies accordingly.
Now, before we wrap up this segment, I want to bring our listeners back to figure 4.2 in the chapter.
Okay.
Remember, it shows the by-V analysis of two individuals with the same BMI.
Yeah.
But vastly different body compositions.
Right.
We've already discussed the implications of those differences, but I want to pose another thought-provoking question.
I am all ears.
If these two individuals were to follow the exact same diet and exercise plan, do you think they would see the same results?
That's a fantastic question, and it really gets to the heart of personalized medicine.
Okay.
Even with the same inputs,
Yeah.
the outputs can vary dramatically based on individual factors like genetics, metabolism, and overall health status.
So it's not as simple as calories in, calories out.
Not at all. Our bodies are incredibly complex systems.
Right.
And there's a lot more at play than just the numbers on the scale. We'll delve into this question further in our next segment, where we'll explore the concept of personalized nutrition and how it can empower older adults to achieve their health goals. But until then, I encourage our listeners to reflect on this idea of individuality and how it applies to their own health journeys.
And remember, there's no one-size-fits-all solution.
Exactly.
What works for one person might not work for another.
Right.
It's all about finding what works best for you. Welcome back to our deep dive. Let's circle back to that question we left you with about those two individuals, the ones with the same BMI but totally different body compositions.
Right.
If they followed the same diet and exercise plan, would they get the same results? What do you think?
Honestly, it's unlikely they'd see the same changes, and that's where personalized nutrition really shines.
Okay, so we're talking about moving beyond those generic recommendations and figuring out what works for each person. And that seems especially important for older adults.
Oh, absolutely.
Yeah.
As we age, our bodies change so much.
Yeah.
Our metabolisms slow down, our muscle mass tends to decline, and we experience hormonal shifts. So a personalized approach takes all of those individual factors into account.
Got it. So like one person might do really well on a higher protein diet.
Yeah.
While someone else might need more carbs.
That's a great example. And it's not just about the types of foods, but also how we eat. You know?
Interesting.
Like mindful eating, portion sizes, chewing our food thoroughly, even the atmosphere during meals.
Oh, wow.
All of that can impact our digestion, nutrient absorption, even how much we enjoy our food.
It's like we have to become detectives of our own bodies.
I love that.
Tuning into how different foods make us feel, noticing our energy levels, and paying attention to any food sensitivities.
That's a great way to put it. It's about taking charge of our well-being, you know?
Yeah.
By listening to those little hints our bodies give us.
And it seems like a registered dietitian could be super helpful in that process.
Oh, they're invaluable.
Yeah.
They can help you understand all those complex nutritional details.
Right.
Factor in your unique needs and preferences and help you make lasting changes.
Perfect.
Yeah.
Okay, so as we wrap up our deep dive on nutritional assessment in older adults, what are the main takeaways? What do you want our listeners to remember?
Well, first off, nutrition is not one size fits all, especially as we get older. Our needs evolve, and we have to adapt.
Okay.
We need to ditch those generic recommendations and embrace the power of personalized nutrition.
Right, and we can't forget those subtle signs and signals our bodies are sending.
Right. Be your own health advocate. Ask questions and seek expert advice when you need it.
Great advice.
Even small changes can make a huge difference.
So true. So it's never too late to start prioritizing nutrition.
Never.
I hope this deep dive has given everyone the tools and inspiration to advocate for the nutritional needs of themselves or the older adults in their lives.
Me too. And if you want to explore further, you can find the full chapter reference in the show notes.
Perfect. Well, that's all the time we have for today. Thanks for joining us on this deep dive.
It was my pleasure.
Until next time, keep exploring, keep questioning, and keep learning.